So as a young girl growing up, I used to be very fascinated, or rather, I found it very difficult to understand why older people always complained about joint pains. And sometimes I found out that they were so painful that some of their limbs got disfigured, or even that they lost their mobility altogether. And then you would think that this kind of conditions are only prevalent with older people. But young people are not left untouched, because some time ago, Nick Jonas of the Jonas Brothers was diagnosed of type 1 diabetes when he was just 13 years old. And yet a lot of people are suffering from this condition without knowing it. So hello, everyone, and welcome to Ibi Speaks. My name is Ibinabo Enebi, and my special guest today is Dr. Deborah Maduka. Dr. Deborah?
Hello.
Welcome to Ibi Speaks. Today, we're going to talk about autoimmune disorders, their causes, the symptoms, and the management. So welcome. So now, the reason why I'm doing this, a friend of mine called me a few months ago and was very upset, or rather distressed, about the epidemic that we're suffering from now, where a lot of young people in their early 50s are dying of, and with little or no preparation and anything like that. So I just felt that for the month of October, I should have a series that will cater for the needs of the older generation, hence today's program and today's topic. So you obtained your MBBS from the University of Port Harcourt, and you're currently a consultant hematologist, yeah?
Yes.
Very good. And so today, like I said, we're talking about autoimmune disorders. And what exactly are or is an autoimmune disorder?
Thank you. I think I'd like to start with the normal before I move on to the abnormal.
Yeah.
It's important to know what the immune system is. Okay, because that should form a background. Simply put, the immune system is the defense mechanism of the human body. Okay? It develops from birth or before birth, what we call embryogenesis, when the embryo has been formed into the fetus and before the baby is delivered. Okay? So the immune system develops right from then. And during this development, okay, the human body parts are exposed to the immune system such that it's able to recognize self and knows that, okay, this belongs to me, and knows that these eyes belong to Ibi, this tissue belongs to Ibi, this smart tissue belongs to Ibi. So into childhood and young adolescence, where the body is trained, the immune system is trained to recognize every tissue or cell in the body. So when it's able to recognize self, therefore, anytime it sees anything that is non-self or foreign, it should recognize that this is not me, this is foreign, and therefore I'm not going to accommodate you. So I'm going to cut you off and you're going to leave. Okay, so that's basically what the immune system does. However, sometimes we can have what you call dysregulation of the immune system, where the immune system develops a problem. There is no proper regulation of the immune system because a lot of things go on in the immune system. Okay, there's regulation of the immune cells and everything that facilitates immunity. Sometimes you have this dysregulation where this regulation is lost, the proper regulation is lost, and then we can now have autoimmune diseases arising. In other words, the body no longer recognizes self tissue or a particular tissue that is self and begins to fight it. So that's in a nutshell what an autoimmune disorder is.
So naturally speaking, or in a normal human template, right, our immune system is built to protect and fight against disease conditions and stuff like that. Yeah, that's the normal human template. Yeah. So when an autoimmune disorder occurs, what that means is that the body begins to fight itself. That's just what it is.
Yes, in layman's terms.
Okay.
Yes.
Now, why do you think that kind of a thing happens?
So, like I said, the cause isn't known, right?
Okay.
You can't say, oh, this is what causes autoimmune disorder. You could say, oh, the falciparum, Plasmodium falciparum causes malaria. But you can't say this is the cause of autoimmune disorder or autoimmune diseases. However, you have certain associations, okay, and certain mechanisms that have been postulated, okay, to explain autoimmune disorders. For example, it's believed that genetic predisposition, all right, plays a role. In other words, some people are more prone to having an autoimmune disorder than others. You also have mechanisms that say, oh, sometimes someone gets infected with a bacteria or a virus. And when these organisms get into the system, they have a way of changing certain antigens in the person's body. Sorry, what I mean by antigens is just anything that an antibody can bind to, okay? Just anything foreign. Your body is an antigen itself, so your tissue is an antigen. So if these bacteria or viruses get in, or these pathogens get in, it's believed that sometimes they can alter maybe the cell membrane or alter the composition of the tissue or the cell structure, okay, that can make the body not recognize it anymore. Now, there's something also they call molecular mimicry. In other words, the bacteria or virus or pathogen, let me just use the word pathogen to cover all of them so that I don't list them one by one. Now, this pathogen could come in, I'm talking about molecular mimicry now. This pathogen could come in and behave as though it is a member of the body. So it now looks like a particular tissue in the body. That's the mimicry. It mimics that tissue. And so the body thinks that your tissue is the bacteria or virus and starts fighting it. Why? Okay. Because that part of your tissue now looks like the bacteria or the virus, whatever it is.
The virus.
Okay, then, yeah, there's so many associations. Even some people have talked about what we call polyclonal B cell activation, where you have pathogen coming in and then the body is trying to respond. So you now have those lymphocytes proliferating in large numbers and all that, you know. So you have these B cells being unnecessarily activated. Some people also talk about what we call an inappropriate expression of MHC class 2 molecules, okay? These class 2 molecules usually is what is recognized, what is usually expressed on what we call antigen-presenting cells. For example, if a pathogen gets into the body, right, we have these cells we call antigen-presenting. That pathogen now is an antigen, right? So these cells of the body now pick up this pathogen, this antigen, and present it to the immune cell that is going to handle it. Okay? It's like somebody comes into the king's palace and you can't just walk in. The servant comes to pick you from the door and presents you to the king to deal with, what do I do with this person? Okay, so that's the work of the antigen presenting cell. It picks up this pathogen when it gets into the body and presents it to the cell that is going to handle it. And that cell is called T helper cells. Now, this antigen presenting cell presents this pathogen in association with this MCH2 molecule, in association with it. So now when you have inappropriate expression of these molecules, the body is now that's by other cells, the body is now will now begin to think these things are foreign, because it's actually meant to pick up something abnormal, a pathogen. But when the other cells are expressing these MHC molecules, right, these antigen presenting cells now begin to take them as foreign. Like, okay, you are with MH2, and so I'm going to present you to who is going to destroy you. You know, so many things, you know, and all these are mechanisms which have been proposed as leading to autoimmune disorders.
Fantastic. Now, somebody has a question and I'm going to ask it. I think she's asking what I have in my mind. She said, I was made to understand that when the immune system is confused, sometimes as a result of some medications, it can lead to autoimmune disease. How true is that?
Oh, that's very true. You can also have drugs alter cell membranes, of cells. That is typically seen in autoimmune hemolytic anemias. You can see that in autoimmune hemolytic anemias, where a drug, for example, very notorious culprit is the aldomet, alpha-methyl dopa, used in control of hypertension. It's particularly notorious for that. So they can bind to the cell membrane, or they can alter the cell membrane, and then the body says, I can't really recognize this. I don't know what this is. This is foreign to me, and starts destroying it. And in this case of autoimmune hemolytic anemia, it happens on the red cell membrane. So you now have destruction of the red cells leading to an anemia.
Fantastic. So what I understand you say from a lay person is that the immune system begins to see the body as its own enemy, right? And sets up a defense mechanism to destroy the body. You've used some medical terms that I can't remember, but all of those things are the system. It's the way in which the body processes or works against itself to fight itself using the defense mechanism that it has. That's just what you've explained, yeah?
Yes, please.
Fantastic. So now, fantastic. Now, I want us to just dig deep a little bit into the causes of autoimmune. Now, are there any predisposing factors? So, for example, we've talked about medication. What about gender? What about hereditary genetics and age? Do they play any role?
Yeah. Okay, yes. I had mentioned, when you say genetics, I had already mentioned genetic predisposition.
Yes.
So that's in other words, if you have genes that predispose you, you are now more prone to have an autoimmune disorder. Then talking about age, yes. We all know that in the very young and in the very old, there's some form of weakness, let me put it that way, of the immune system. The young because the immune system is still developing, and then the old because it's old and it's wearing off. So it's not as active, it's not as sensitive, it's not as agile as the immune system you find in the age range in between. That's the young adults and the adults. And then as for sex, yes, females have been found to have more predisposition to autoimmune diseases than males. And basically, I believe the reason, which literatures say, is because of the X chromosome which we carry, because the X chromosome is fraught with a lot of autoimmune prone things. So, and we have 2 X's anyway, and men have only 1. So women tend to have more.
What are the most common classifications of this condition?
Classification of autoimmune disease. Well, basically you have the organ-specific immune diseases, right? As the name suggests, is targeted at a particular organ. And then the systemic, as the name suggests, affects more than one organ. It affects 1, 2, 3 organs or different systems in the human body. So those are the 2 major arms you find autoimmune disorders into.
So we have the organ and then we have the systemic. So what are the most common types then of autoimmune disorders?
For the organ specific, we have the type 1 diabetes mellitus. We have Graves' disease. We have myasthenia gravis. We have the autoimmune hemolytic anemia I had mentioned earlier. All right. We have pernicious anemia, Addison's disease, amongst others. Then for the systemic, commonly we have the systemic lupus erythematosus, commonly known as SLE. Name is long.
Okay.
We have multiple sclerosis. We have rheumatoid arthritis. We have we have Durant syndrome. We have scleroderma. We have ankylosing spondylitis, and the list goes on.
Yeah, the two that I'm very familiar with would be spondylitis. Yeah, the bones, the one that people complain about, bones, and then rheumatoid arthritis. Yeah, okay. Those are the ones that I see. Like, you know, in the introduction, I was saying that when I was growing up, I used to hear a lot of women would come, you know, you would hear women complain about leg pains and joint pains, and sometimes their limbs are practically just deformed, like disfigured, because of the way that their limbs are all mangled up, and some of them actually lose mobility, you know, lose movement because of those because of that condition. Yeah. So, you know, in your practice, what is the most, or which are the most common? Can you give us what the most common, and then the symptoms? In my practice, what I have seen, because I haven't come across all the types. I've come across patients who have all the types, but being a hematologist, I have seen patients with autoimmune hemolytic anemias. I've seen patients with immune thrombocytopenias, which you call ITP. I've also seen patients with SLE, that's a systemic lupus erythematosus. Okay. I've also seen patients with multiple sclerosis. I've also seen a patient with rheumatoid arthritis, yes. And also patients with type 1 diabetes mellitus. Okay. And more recently, as far back as 2 weeks ago, I saw a patient with pernicious anemia. Wow. Can somebody suffer from more than one condition? Yes, it's very possible to have two conditions. As a matter of fact, this particular patient I had 2 weeks ago had was suspecting pernicious anemia, and she also had this thyroid swelling. So likely she has Hashimoto's and pernicious at the same time. So we had sent for a thyroid function test anyway and requested to do a thyroid scan. So yes, I can actually have more than one autoimmune disease happen at the same time. I have this question that I was thinking about. You know, the way, you know, like every year we all go for our medical checks. You know, we do our blood checks, we do, you know, all the system and everything. If somebody is genetically predisposed to this condition, can you pick it from the blood test before it becomes obvious? There's a particular test you can do that shows that you have an autoimmune thing going on, but it's not specific. Okay. And that's the ANA test, ANA test. That's the anti-neutrophilic antibodies. So if you could pick up those antibodies, it shows that, okay, yes, this person has an autoimmune thing going on, but it can't really tell what exactly it is. Because really, in the diagnosis of autoimmune diseases, there must be symptoms, okay? Patients will actually come down with symptoms. So the physician puts together the symptoms, physical examination, your findings and physical examination, and your tests, investigations that you do, one of which is the anchor, and then the rest are specific to where, by virtue of your symptoms, your history and examination findings, pushes the investigations to. Because someone, for example, could come in and say, oh, I've been losing weight, I've been drinking a lot of water, I'm always thirsty, I wee more at night than before. Okay, now somebody tells me that my mind will not be going to a thyroid problem. So I wouldn't be thinking of investigating a thyroid problem. My mind will be going to maybe this person has a sugar problem because this person's urinating frequently and all that. So I would want to investigate in that line. So the history you give, the symptoms, the examination findings I get will direct the investigation to be done. Okay, so like, you've mentioned the symptoms for the type 1, maybe. Is that the type 1 diabetes, right? So can you give us some of the common symptoms, like if someone has SLE? Let me put it this way. SLE is it's a systemic thing. So it doesn't really have specific presentation. Okay. Yeah, but
because it's a connective tissue disease, I think one of the characteristic things that we look out for is the butterfly rash. Okay. What they call the butterfly rash, which is like the rash around here, right? A discoloration around. Yes, but sometimes you may have a patient who has SLE who doesn't have a full blown. By that I mean it hasn't gone so far as to form the butterfly rash, but it's already having one or two features. Okay, so it's, first of all, the physician has to have a high index of suspicion, especially when the presentation is non-specific. Yeah, SLE could come in with anything. Like when I spoke with you some hours before now, I mentioned something about SLE and a patient I had once who had SLE who was actually got a consult from internal medicine. Okay, from internal medicine, you know, oh, she's pale, she has anemia, and she has neutropenia and all that. And then we said, okay, as a hematology department, we went to see some of the doctors with myself. We went to see this particular patient. And by the time we ran a full blood count, found out that, oh, it was not just anemia. She had thrombocytopenia, she had neutropenia. There's a pancytopenia. In other words, cell lines are down. I'm like, okay, what's the problem? We said, okay, because she had so much anemia, right? We said, okay, we need to transfuse her first. I mean, we have to stabilize her circulatory system, the cardiovascular system. Her anemia was so, and in trying to transfuse her, she kept reacting to every unit being given. And so we're like, what's this? This is very unusual. And so we said, okay, we take the unit back, we discontinue transfusion, take the unit back, recross match. So she seemed to be reacting to almost every unit. And we said, okay, something is going on here. There's an autoimmune thing going on here because she is reacting to almost every unit she is being given. And that now increased our index of suspicion. And few days after, she now began to have this thing. We're like, oh, okay, something is happening. Yes, and so we now have to for the usual test, you know, anti-neutrophilic antibodies and all that, double-stranded DNA. We sent for all that, and they came out positive and said, oh, this lady actually has SLE. Okay, so I'm just trying to say sometimes it could be very non-specific because it could actually affect any tissue, any part of the body. The patient may not even come with anemia. The patient could come up with something else. Okay, for someone who has neutropenia, meaning the neutrophil count is very low, the tendency is that the person gets easily infected. That person could just come up with a fever, just present with fever, is not relenting. The person is using different things, using antibiotics, antivirals, and the fever is not coming down. It could just be the only presentation the person comes to the hospital like, doctor, I've used also antibiotics, I've taken antimalarials, and this fever is not abating. That's why I'm here. Okay, so sometimes the presentation is non-specific, but when you begin to see a lot of non-specific symptoms and you ask more questions, you, with a high index of suspicion, chances are that you could make a diagnosis of SLE. However, SLE is not like it's common. Autoimmune diseases are not so common as other diseases like your infectious disease and all that, but yes, they are there.
They are there. Okay, what about the ones the ones I talked about that starts with leg ache and body ache, and then how do I know that that is a condition that we need to worry about?
Okay, first of all, her age gives her away. She's elderly. Her sex gives her away. She's a female. Yeah, meaning she's going to be more predisposed. And then she complains of this pain. Okay, and then of course you said she came in, she had deformities and all that. So when you see an old man bent over like that with deformities here and there, I mean, your mind starts going to an arthritis, joint pain, inflammation of the joints. It's when you do your further investigations to check, oh, is there an autoimmune thing going on, that you can now say, oh, this is like rheumatoid arthritis. If not, the first thing on your mind, I'm seeing that woman walk through my clinic door, is that this woman probably has an arthritis from her history. But it's when you now begin to investigate further and send for further tests that you can now say, okay, this is not just arthritis of old age. This is a rheumatoid arthritis, which is like an autoimmune thing. Because to start with, we begin to have arthritis anyway.
Yeah, I was going to ask that. So what's the difference between the normal arthritic pain? What differentiates the autoimmune condition to the normal aging and wearing out of the ligaments or joints condition?
Nothing. There's no difference in my opinion. Because it's still the same joints that have been affected, right? Now, if you were to hit your little toe against the box, it's going to pain you as much as when you hit it against a stone. It's the same toe, it's the same nerve endings, right? It's the same blood vessels that are there, same nerve endings that are there, same neurotransmitters between the nerve synapses and all that. So pain is pain.
Yeah.
Basically, pain is pain. Yeah. So the only thing I think might be different is when you start doing your investigations, because once they have pain in their knees, okay, the tendency is that you want to modify the way you walk, the way you stand to relieve that pain. And in doing that, they begin to now come up with all forms of positions. Okay. And then there's still, because these are weight-bearing joints, you understand? So the tendency is that in order to take a position that kind of alleviates or relieves the pain, over time, they take that form. Some are bent over and all that and all that. And of course, there's a lot of inflammation going on in the joints. So with repeated inflammation, over and over again, healing is trying to take place, inflammation is trying to take place, healing is trying to take place, inflammation is going on, destruction is going on, healing, everything is happening simultaneously. At some point, you now have what you call like nodules around those joints. Because there's a repeated process. Let me give you an example. When you cut yourself in your hand, right? And it heals. I assume it's a very deep cut and it heals. You have a scar tissue there. Okay. So the same thing happens with the bones. Okay. There's inflammation, there's an insult going on, and then it's trying to heal. That tissue is harder than what was there before. Okay. It's not as normal as what was there before. And then there's an insult to it, and then it tries to heal. There's an insult to it, and then it tries to heal. So you just have it increasing in size and all that. So you're going to have all these noodles and bunched up things around the joints and stuff. Yeah.
Fantastic. Now, there's a lot of talk about, before I go on, before I ask that question, let me just look at what somebody said here.
Okay.
Somebody says good presentation. And someone says the amount of weight my joints are carrying. Whoop, God help me. So now, does somebody's weight have anything to do with all of these conditions?
Well, weight in itself, what I know it can do in someone who has an arthritis or autoimmune rheumatoid arthritis is that it worsens the condition, because the problem is usually with the weight-bearing joints. So the more the weight, the more the joints have, the more work the joints have to do. So it's only going to increase the pain. So one of the advice given to patients who have arthritis or rheumatoid arthritis is to lose some weight, take some weight off the joints to allow to heal. Okay, so apart from resting those joints, you have to do some work on losing the weight and all that to allow the joints to heal.
Fantastic. Now, I was going to ask you, the way and we talked about it just this afternoon. So there's this buzzword, there's the free radicals, antioxidants, and all of those things, inflammations and all of that. And whenever you hear people talk about autoimmune disorders, you hear them talk about I watch a lot of things, and these words, free radicals, and and all of these things are thrown in. So what exactly are they, and how do we walk around them? What are free radicals, by the way?
Okay, free radicals are more like reactive oxygen species. Okay. They are like byproducts of oxygen metabolism, and usually have them when you have some inflammation going on. Okay. The body is trying to fight off something. Usually when there's an insult or an invader, and then the body is trying to fight it off, usually have release of this free radicals. So they're actually reactive oxygen species. Okay. Now, talking about antioxidants, what antioxidants help to do is to mop up these free radicals. Okay, because they play a role in inflammation and they could actually be very destructive. Like when I talked about the innate immune system, which has the neutrophils, phagocytes, and all that, in the process of their phagocytosing the pathogen and destroying it, they release free radicals into the surrounding environment, which now destroys, which could destroy the tissue around them. So what antioxidants do is to mop up these free radicals so that you have less injury to the tissue around where this activity is going on.
So the free radicals are what cause the inflammation,
The free radicals are, it's like a vicious cycle, okay?
Okay.
In inflammation, what happens in inflammation is that first of all, there has to be an insult or a bacterial invasion or something, pathogen invasion causing an injury or an insult. So what happens in inflammation is that if something happens in this part of the body, what happens is that you have the blood vessels there increasing in size. So there's an increase in blood flow. However, the end capillaries where the action is usually taking place are constricted such that you have them bunched up, filled up with blood. Okay. Now, as these vessels are filled up with blood, you have the neutrophils, these cells that are supposed to be fighting infections, come in. They move along the wall of the blood vessel and then skip in from the blood vessel into the tissue to go and attack whatever is there. Now, because these vessels are full of blood, that is what you see as redness. Okay, when you have an inflammation, that's what you see as redness in your skin. That's what you see as warm. That's why your skin now becomes warm. There's a lot of activity going on in there. So now the white cells, let's move back inside. These white cells move into the tissues, these neutrophils, the phagocytes, the monocytes, they move into the tissue to take care of the insult or the invader, whatever it is. Okay, and as they are doing that, okay, they are releasing enzymes and all that. As they are doing that, free radicals, the metabolism is being released into the tissue. It's used also in destroying the organism, but some are released to the surrounding tissue and may cause damage. All right. Now, another thing you have inflammation is what they call pain. So when all that is happening, you find out that place is red, it is warm, and it is paining you. Okay. In some cases, if for some people, in some cases of inflammation, if it's so extreme, they might even lose function of that area for a while until the inflammation resolves. Okay. Now, as this inflammation is going on, these free radicals are released. Okay. Inflammation is going on. These cells release the free radicals. These free radicals in themselves can injure the cells around them, causing more inflammation. So it can actually be a vicious cycle. But in the human body where there is proper regulation, after a while, you have antioxidants that come up and mop up this thing and quietens the whole thing. Because inflammation is actually the first part of healing. Okay, so and then healing starts and everything gets quiet, and then the redness starts reducing. You start having more sensation there, the pain reduces and all that. And then the scar tissue is formed and then your hand is fine. Okay, so it's like a vicious cycle. The free radicals are released from the inflammatory process, but they also can trigger more inflammation because you're injuring it. So once you injure a cell, the normal body tissue, you will trigger inflammation.
Okay, so now, thank you very much for that explanation. I think now I understand what free radicals are. I understand it better. Now, you talked about the antioxidants, right? You know, as we grow older, our body's ability to produce them begins to diminish. Now, this brings me to the next question. Can our diet, the kinds of food that we eat, help us in reducing the chances of developing autoimmune conditions?
Medicine is moving into lifestyle modification to help the body. Because in the first place, our lifestyle and environment have contributed to disease processes. With people having autoimmune diseases, there is no cure. Let me just lay it out there. However, you can reduce the effects of the disease process. And one of the things you want to do in reducing the effects of the disease process, if you understand the pathogenesis, is to take in healthy foods that could give you antioxidants that we believe will help mop up excessive free radicals floating around there.
Very good.
If these antioxidants do this, why not increase their presence in your body? So therefore, we advise take your fruits, take your vegetables, and increase the antioxidants that you have. So yes, but when you begin to take foods that are highly processed foods with high fatty diets, you increase the concentration of free radical. Not very good for the body. That's why they say, as much as possible, stay off cakes, meat pies, buns, all this highly processed, It's like I poked you somewhere.
You did.
Especially as you age. But I'm of the opinion that even with children, yes, people say, they run up and down, they'll always burn it. We adults shouldn't take it because we can't burn it. I think even with children, you should be cautious of their diet. Don't just throw in anything into your child. Child is not a dustbin. It's just that in the age we live in, it's the fast age. We were looking for 30 hours in a day. You don't have that time. So sharp, you want to buy meat pie something, just give your child, let it hold his or her stomach, do this, but as much as you can, it's best to reduce refined foods. Even for our children, more so because they're developing anyway. So why do you want to throw in refined foods? They need what is natural. They're still growing. The brain is still growing. So
what I hear you say is that processed food is harming the body. So you're saying minimize or reduce the intake of processed food and eat healthy foods, right? Would be good. Now, there's something we're talking about this afternoon. Assuming somebody already has the condition, would eating vegetables and fruits at this stage be of any benefit, or the person has to be taking medications all the time?
Okay, let me say this, that autoimmune diseases have, fine, there is no cure, but there are times of what we call remission. Remission is when the immune responses at that time quieten. Okay. For some of the diseases, they quieten, like for example, multiple sclerosis. It has times of remission where it quietens, and it has times when there's a flaring, comes up again. Okay, so there are times like that. But like from what I say, yes, someone already has multiple sclerosis. Okay, taking fruits and vegetables will not stop it from coming up again. But at the time of flaring, I want to believe that if you're someone who takes in a lot of antioxidants, it reduces the ferociousness of the immune response. So, like I said, it's just human reasoning. Like, antioxidants have been seen from research and experiments to do this to free radicals. So if antioxidants can do this, why not take more of antioxidants to reduce the effect of the inflammation? So yes, it's advisable you take in more of antioxidants, taking your fruit and all that, your vegetables, so that you have more of that. So it kind of reduces the immune response, the vicious immune response. So it quietens it a bit, so that if it was in stages of, it was going to hit 70, maybe by the time you take your antioxidant, it hits maybe just 50, and it's not as high as 70, and debilitates the person or something. So yes, it's advised to take.
My mind is just going back and forth, and I want to ask you this. So if someone is predisposed to having an autoimmune disorder condition, would making healthy lifestyle choices, eating healthy fruits and vegetables, would it help?
Well, there's no harm trying.
Yeah.
Like I said, it's a predisposition. You may have it, you may not have it, whether you take it or not. It's just a predisposition.
But you could do something to minimize.
Let me make it clearer. For example, hypertension, okay, is known as a familial disease. In other words, it flows in family trees. So in other words, if your father was hypertensive, maybe your mother, or maybe your grandfather, chances are that you're going to be hypertensive by a certain age. Okay. So one of the things you want to do, because you have that genetic predisposition already, is to maybe before you're 40, cut weight. Before you're 40, you cut it on your fatty diet, cut weight on you cut your salt intake, you exercise more often. You already have the familial predisposition. So you start doing all that, and you get to 40, 45, 50, and you find out that, no hypertension. Or you're doing all that and you still get the hypertension anyway.
Anyway, yeah.
That's
so that's the balance.
So that's the balance. So you just do, I say it as, do the healthy thing. Do what you should do, not to fuel the process. If it's going to come anyway, it's going to come. But do what you should do to maybe delay its coming. It may delay whatever is coming to come, or it may give you a better clinical outcome than someone else who is not doing it.
Anything at all.
Yes.
Can exercise help? For
autoimmune disorders?
Yeah.
I haven't read about that anywhere.
I'm just asking because they say exercise and diet.
Sorry?
Because, the thing now is exercise and diet would help keep you healthy. It builds up your immunity. So I'm asking.
Okay, yes, because let me put it this way. What exercise does is it gets your circulation alive.
Yeah.
Okay, it gets your circulation alive. And when your blood is moving well through the blood vessels, remember, blood is also a purifier. It transports useful things and unuseful things. So the more you have your blood flowing and passing through the kidneys will be collecting all the nonsense. Okay, someone who is then someone who is just there. Like now, if I go out and run a lot, my heart rate is probably going to move from maybe it was 70 something to about 90 something. And that tells me that more blood is being pumped, more is moving around the body, more blood is passing the kidneys, and so the kidneys are doing more filtration.
Yeah.
Okay. And then as you do exercises too, the tendency is that you're going to be breathing, panting, and all that. So you're going to be taking in more oxygen for your tissues. Okay. And then there's something about doing more exercises. Like for some people, they say they have arthritis, or if they have a rheumatoid arthritis, they say sometimes exercising or massaging the place gives some relief. That's because when an inflammatory process is going around the joint or something, you have accumulation of these free radicals, cytokines, and all the dangerous things that are causing problem there. So when you have increased blood flow and circulation, it helps to wash off these things from that site. Okay, it helps to wash off some of these things from that site and reduces the pain. I'm just trying to explain it in layman's language, sort of, so that you could understand.
Yeah.
So that's pretty much what I see as the benefits of doing exercises, and then combining it with healthy diet. Why not?
Yeah, fantastic. So I want to ask about, is there any cure
for autoimmune diseases?
Yeah. There's no cure, yeah? But can it be managed?
Yes, it can. It can be managed. We've pretty much talked about the home management from what we just discussed. Yeah, but from the hospital point of view, the physicians, more or less with drugs, and what they do is to try to suppress the inflammation as much as possible, maybe give you drugs that will suppress those immune responses, what they call immune suppressants, okay, to suppress the inflammatory process going on and causing all the havoc.
Yeah. Fantastic. This has been a very enlightening session. To be honest, I learned a lot. This has been very, very, very good. I think the thing that I've learned today is you explained the free radicals for me very well. And I have to cut down on my cakes and ice cream then. Because I love them. See, because I love them. And it's my birthday today and I need to eat some cakes.
Make sure you send some cake down.
I will. So viewers, I mean, if you have any questions or any comments, please feel free to leave your comments and questions, and my guest will be able to answer as much as she can. Now, assuming there's someone here today that is experiencing an autoimmune disorder condition, what would you say to that person? Can somebody live a near normal life with a condition? Is it a death sentence?
I wouldn't say it's a death sentence if it's properly managed. However, there are some autoimmune diseases that at the end, maybe. Because, for example, let me give an example. An example is multiple sclerosis. Yeah. You know, it has its remitting and relapsing times. Okay. There are times when it flares up, it comes up, and there are times when it dies and quietens down. And then fine, you treat the patient with immunosuppressants. Sometimes they give high dose steroids and all that. And then the whole process calms down. But the problem with it is with each episode, it's worse than the previous. So, and then it now depends on where it's affecting. Okay. If it's affecting the spinal cord at a level where it supplies the heart, or it supplies the lungs, where the spinal cord, the nerves from the spinal cord are supplying the heart or the lungs, you know, that's a dangerous place to affect, you know. So the problem with multiple sclerosis, for example, multiple sclerosis, is that with each episode that comes up, it's usually worse than the first, you know. So I would just say for anyone with an autoimmune disorder, it's manageable, it can be managed like hypertension.
Yeah.
Okay. If the patient is closely monitored, closely watched, it can be managed for some time, right? But I don't want to sound like the prophet of doom. but there are some that you can't really determine where it's going to attack, like the example I just gave. So, but yes, it can be managed, and some people have lived with it for quite some time. Some are not as, for example, for patients that maybe a patient who has an autoimmune hemolytic anemia probably was second to the drug. Okay, if you take off the drug, it will stop. So it depends on the disease process, the disease itself. That is for an autoimmune hemolytic anemia. But the other side is the multiple sclerosis I just described. And so it actually depends on the type of the autoimmune disorder in question. If it's not like the ITP or the autoimmune hemolytic anemia, that can be easy, that is not as bad. Yes, it can be managed for a very long time. You can live a near normal life as long as you're on proper management, treatment. Yes, it can be managed well, like hypertension. Patients who are diagnosed in their 40s and they're still in their 70s and they're still okay. So yes, it can.
Would find it out early help?
Oh, yes, it will help. But like I said, it still depends on which one.
Wow. You have been very honest. You're not painting anything here. You're just saying it the way it is. Yeah. So thank you very much, Dr. Deborah, for this insightful interview. And viewers, don't forget to like my YouTube channel. It's Ibinabo Enebi. And if you learned a lot, please, if you have comments, kindly leave your comments below. And next week, I have another guest who would be talking about mental health, because October 10th is World Mental Health Day. And I would have a guest who would speak on mental health. And I'm delighted. And Dr. Debbie, thank you very much. And I'd like to thank all my viewers that have been here today. And thank you so much for giving me your time. And thank you. So, Dr. Debbie?
All right, no problem. Happy birthday again.
Thank you. Bye.
Bye.
Bye.